Next, we're going to look at a few spinal nerves of interest, so just some that he mentions. So what are some spinal nerves of interest? I'll write some names and we'll talk through them. All right, so the phrenic nerve is going to innervate the diaphragm. So the diaphragm is your main muscle that's going to be used to help you breathe. And the phrenic nerve comes from the cervical plexus. We'll talk about nerve plexi in just a minute. So the cervical plexus. And this thing controls the diaphragm. And when you get spasming of the phrenic nerve, this is what is causing hiccups. So you basically have spastic breathing when you're hiccuping. Okay, the median nerve is our next one. This is going to be going to our skin and so the skin of the hand, and also the controls like the flexors of the forearm and the hand. So that's going to allow us to wiggle our fingers and do that thing called opposition, which is where we can put our thumb to our other fingers, which makes us very human. So this would be like skin sensation, as well as flexors in the forearm and hand, which will allow us to do things like opposition, which is touching that thumb to those other fingers. All right, next is the ulnar nerve. So the ulnar nerve, this is at the surface of the skin on the elbow. And again, these should all have nerve after them. So phrenic nerve, median nerve, ulnar nerve, sciatic nerve. Okay, so when you hit that ulnar nerve, this is what gives you your funny bone sensation. And why is it called the funny bone? Because the ulnar nerve runs over the humerus. So that's that ball and socket joint bone in our arm. So it has the ball, and then it has the rest of the bone down here. And so this is going to meet with the ulna right here, and then the radius comes down as well. So this ulnar nerve is going to be wrapping around this humerus like this. And whenever you hit your elbow, you hit that funny bone. This is the humerus. It's going to be active. It's going to just activate, causing a little spasm of that nerve. That gives you that funny bone numb sensation. Okay, so the sciatic nerve, this is the largest nerve in the body, largest and thickest. So the trigeminal was the largest cranial nerve. This is just the largest nerve in the body. And thickest. So this is going to control the lower limbs. And this is something that he mentioned a few years ago, except the anterior medial thigh. So your quad has 4 different muscles, and I'm guessing that the sciatic nerve doesn't innervate one of them. But that's just a guess. All right, this last one. Pudendal nerve. This is going to go to the muscles and skin of the perineum. So the perineum is the skin in between your genitals and your anus. So whenever mothers are giving birth, sometimes they have to cut right below the vagina and cut into the perineum to help allow for more space for the baby to come out. Otherwise, typically the perineum just tears. So that's where you might have heard it before. But the pudendal nerve is going to innervate the skin and muscles of the perineum. And remember, the perineum is that stretch of skin in between the genitals. So if this is legs going like this, and this is someone's genitals up here, and this is their butt. So this skin in between the genitals and the butt right there, that would be your perineum. So I talked about that childbirth example, but what the pudendal nerve specifically, so that was just to explain the perineum. When we talk about the pudendal nerve, this is the thing that's important for voluntary bladder control. So we know that our bladder can contract and we feel like we're about to pee our pants, but we know that we have voluntary control over that after you're potty trained. So that's because the pudendal nerve controls that. And this is also involved in male erections. during sexual arousal.